welcome. You are watching The Island Docs. I am Dr. Sandy, and this is my co-host, Dr. Gordon. And today we are joined by a very special guest, Dr. George, and we are here to talk all things health and health related. Today our topic is child safety. So pull that chair in if you're a parent, if you're a grandparent, because this is something that you do not want to miss. We're going to be discussing what to do when your baby is choking, what to do if your baby had a near drowning experience, how to do CPR properly, and also what are the signs of child abuse. So let's just get started. Dr. George, what do we do when you first see that your baby is choking?
Okay, so we'll start with a child model. So the first thing when you see that your baby is choking is that you want to look into the mouth. So you're going to pull the mouth open. Please do not go in with your finger, or what we call in the medical term a finger sweep, unless you actually see something in the mouth.
Yeah,
if there's nothing,
before they used to say that you need to do a finger sweep.
But the problem is with doing a finger sweep when you cannot visualize the object in the mouth is that with putting your finger, you can actually put the object further back. So we really try to avoid doing a finger sweep unless you see something in the mouth. The second thing you do is, whichever hand is your dominant hand, that is what you want to do the thrust with. So put the dominant hand underneath the baby, and your non-dominant hand, you're going to put it in a V around the baby's mouth, similar to what I'm doing. And you're going to turn the baby over, tilt the baby downwards, and you're going to do a thrust, a back thrust. Okay? You're going to try to expel the object out, and turn the baby over, look and see how the baby's breathing, and if it's still choking, again, you repeat.
Now somebody should be probably calling for
Definitely
some assistance when this is first noticed.
Yes.
So this is what you do while you're waiting for assistance.
Correct.
You don't just sit and watch the baby. You start to do these movements right away.
For everything in medicine, if there is anybody in distress, whether it be a baby and an adult, the first thing you should do is call for help. Help should be on their way while you are doing your steps to be able to help open up that airway or help dislodge that object.
Okay.
So we've done a lot of work with small babies. What do we do if they're a bit bigger and we can't manipulate them as much with our hands?
So if you're dealing with an older child, an adolescent, or an adult, you want to find the end of the breastbone, or what we call in the medical term the sternum.
Okay.
You find the end of it.
You can just
you're
track
going
all
to
the way up.
Yeah. So or you can even start from the top and track down until you meet the end of the hardest point.
Okay.
And you're going to put your hands in a bit like a fist like this.
Mm-hmm.
You're going to rest it there, and you're going to thrust upwards. You're going to be doing this from behind the person.
Okay.
So you're going to hug the person around,
Okay.
come in,
So you're
and
just gonna,
thrust
like,
upward.
Hug from behind.
Yes, like that. And then thrust upwards.
Okay. All
Okay?
right, definitely.
And of course, the beauty about safety is that you have to also recognize your safety first. So always make sure that you're in an area that is safe, that you are not being overpowered by the person that you're trying to protect, because that person is just going to fall back on you while you're doing the thrust. If you meet a person on the ground that is choking, then try to do it with the person sitting. You don't necessarily have to stand the person up.
Okay. So in the Caribbean, there's a lot of water in the form of beaches and pools. What do you do if your baby looks like they're near drowning? How do you do CPR?
Okay. So first you put the baby onto a flat surface. You assess to make sure that the environment is safe for both you and the infant that you're trying to resuscitate. You look to see is the baby breathing. You can assess the pulse of an infant by the brachial pulse. So that is just feeling along here
Where the arm
bends. Perfect.
Okay.
To feel if you feel any kind of pulsation. Of course, don't do it with your thumb, because your thumb in itself has a pulse. So do it with any other fingers. You can do it with 2 fingers, 1 finger, depending on how chubby your baby is. And if it is that you realize that there's no pulse and the baby's not breathing, then you initiate help first and then CPR.
Okay.
So the first thing that you want to do is you want to give the baby 2 good breaths.
Okay.
So you want to lift the jaw up, and you will deliver 2 good breaths, watching to make sure that with each breath the baby's chest rises, because that tells you that you're getting a good amount of air into the lungs.
Now, what do you mean by a good breath? Like, you mean like to really push a lot
Yes.
of air into the baby?
Yes.
It would not harm the baby at all?
No,
Okay.
because you are using your own, the amount of pressure that you will generate giving a breath wouldn't be as much pressure as if you were using the bags that the EMT will use.
Okay.
So for yourself, you don't have to worry so much about the amount of breath that you give in. You really want to get enough breath in there that you see that the baby's chest rises. Okay? After giving 2 good breaths, the next thing about CPR is being able to get that heart to now pump that oxygenated blood. So you can do 2 methods of CPR. You have the baby on a flat surface. You can do the 2-finger method or the 2-thumb method. So we'll first start with the 2-finger method. You're going to look for the end again of the breastbone. And with most babies, it's very easy to find. It actually, for some babies, protrudes and you can actually see it. So you're going to look for that, and you're going to start chest compressions. And you're going to press hard. Don't take your fingers off. So you're not bumping up and down like this. You're keeping your fingers on the chest, and you're pressing down. So 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8. And you're going to do this 15 times because you're trying to get that heart to pump the blood. And then you're going to turn again. Lift the chin to be able to get that airway open. Deliver 2 more breaths, 2 more good breaths, watching that chest rise, and start again. 15 compressions. If, however, you do have help, that there's somebody available to help you, then you can make that person in charge of the airway, in charge of giving those breaths, and you can now give 1 and 2 and 3, and the person delivers 2 breaths. Breathe. 1 and 2 and 3 and breathe. 1 and 2 and 3 and so on until you get help.
And you normally go for a count of 50.
Yeah.
1, 5.
1, 5.
Okay.
And then after 5 cycles of this, reassess the pulse. See if it is that you have a better pulse. And if you don't, you continue until help arrives.